The number of women dying during pregnancy has dropped for every racial group except for Black women. That's according to the Centers for Disease Control. They are far more likely to die than their white counterparts, regardless of income or education.
And in Colorado, the Maternal Mortality Review Committee says discrimination contributes to 2/3 of those deaths. Two state lawmakers brought a bill to address that disparity. But as your political reporter Sean Boyd reports, all of the enforcement measures were stripped.
Nikki Sworn is a born fighter, delivered at 26 weeks with her umbilical cord wrapped around her throat twice. She says she might have died if not for a female doctor who, against the advice of male doctors, encouraged her mom to give birth vaginally.
It was someone advocating for her and her wellness that made the difference.
The kind of advocate Sworn wishes she'd had when she learned she was unable to get pregnant.
I wasn't given the option to say, hey, would you like to freeze your eggs?
Those experiences, she says, led her to join Sister to Sister, an organization focused on the health of Black women, who are more than 3 times as likely to die from pregnancy-related conditions as other women.
Historically, people of color, especially African American women, have been discounted and discredited when it comes to pain.
Sadly, some doctors are trained as Black women can handle another level of pain that no one else can.
Representatives Regina English and Junie Joseph are working to change that. They introduced a bill that requires state medical boards to consider new training for doctors and nurses on cultural competence and equity in maternal health.
Saving one person's life from having a better educational experience and saying, I really didn't realize I had a bias, or I didn't realize that this information would be helpful for me to share with my patient, is transformative.
The bill also requires labor and delivery facilities to provide pregnant women with a statement of their rights, including the right to care that is culturally sensitive and free from discrimination.
We may want to have 3 or 4 different people in the room at the same time because it's a cultural effect for us, and being denied that opportunity is also unfair. We find often sometimes that there are midwives that get turned away as a part of a care team. Doulas can be denied access to rooms as a part of a care team.
While the measure initially required the state to investigate and fine facilities when there are maternal deaths tied to discrimination, that section was eliminated due to cost. Analysts expected 421 investigations a year.
There's no balance of accountability in this space, then what are we really doing? How are we changing community and how are we changing outcomes?
The legislation does require the state to survey more women who give birth, including questions about cultural sensitivity and equity.
This is about reproductive justice. Ultimately, we want everyone in the system to be accountable because we don't want Black women and other women of color to be dying just because of the color of their skin.
But we should not have to die giving life. And we can do to save lives of Black women and save lives of Black babies, that's what we're going to do.
Sean Boyd, covering Colorado First.